Hi there, I'm Dr. Gigi Shamus, and thank you so much for joining our webinar. We really look forward to talking about COVID-19 anxiety and some aspects of PTSD as well. And it's presented by Five Branches University, which happens to be my alma mater and where I currently work. I'm a licensed acupuncturist and a doctor of natural health, and we'll be talking with Joanna Zhao, who was my academic dean at the time and still is the academic dean and the clinical director at Five Branches University. Of course, that's in San Jose and in Santa Cruz. Go ahead and grab yourself maybe a cup of tea. I have some mint and lavender, really good for anxiety and stress reduction. And we'll get started in just a minute. And you're always welcome to type your questions into the chat box so that we can answer them at the Q&A at the very end. This webinar will be recorded so we can share it with you later. Of course, COVID anxiety could include the anxiety we've all felt about this pandemic and how it's ravaged the world for the last year. And it also includes the fact that when people do catch COVID, they tend to have much higher levels of anxiety at that time and even afterward. So we wanted to address both of those things with 10 minutes of TCM, traditional Chinese medicine. So traditional Chinese medicine can be acupuncture, but it can be many other things, including herbs. It can be exercises you can do at home, nutritional advice, and so on. We are so sorry if the pandemic has affected you and your family and loved ones personally. And many of us have felt as though our lives are so different now, even if we have not been personally affected by COVID. So at this point in the pandemic, about 120 million people worldwide have caught COVID. Of those, 67 million have recovered, and unfortunately 2.6 million have died. And basically what we're looking at is how can we assist with Chinese medicine the high levels of anxiety, both from, of course, just living through a pandemic, and secondly, for those that have experienced the shortness of breath of COVID, the difficulty walking, the extreme fatigue, the malaise. What can we do to assist them? So as acupuncturists, there's certain points that we can needle to help our patients overcome their anxiety. And for lay people, there are certain points you can press on yourself at home that can have a wonderful effect, a very calming effect for your general well-being. And on a personal note, for those of us that have actually become parents in 2020, I hope that your anxiety has been manageable. I hope that the things that we talk about today can also further assist. Joanna received her education from Shanghai University in the People's Republic of China and has actually been leading tours back to China since 1992 for students at Five Branches. So we'll go ahead and pass this over to Joanna Zhao, who's going to share with us some pearls of wisdom from Chinese medicine.
Hi, everybody. My name is Joanna Zhao. I'm an acupuncturist and also Chinese medicine doctor, practice in Five Branches and my own clinic, and also teaching the class. So today I'd like to share with you, because I know you are all acupuncturists, you already see many of the COVID-19 patients maybe, or post-COVID-19 patients. So today I just like to share my own experience, the post-COVID-19 treatment. I thought the COVID-19 virus would be like other virus. They finish. But this one, unfortunately, is not that way. Some patients, of course, luckily, they don't have symptoms. Some patients have many post-COVID-19 symptoms. For example, I have a patient who is a pharmacist. She said after the COVID-19, she was okay for a while, but later she feels like she couldn't concentrate because, she's a pharmacist. She had to be sure 100%, fill in the medicine. So she actually called me and I did a telemedicine with her. So I found out she is very dry and also can't sleep well. Of course, if you don't sleep well, next day you won't feel good. And she said, I used to have insomnia sometimes, but not like this. This like I have fog in my head. So this is a one. And I have another patient who is just he said he's PTSD now because he's just worried and suddenly wake up at night, and also doesn't want to do exercise. He used to do exercise every day. He said it's no energy. And also I have another patient who has short of breath. He thought after the COVID-19 he might, no short of breath, but he still have it. And walk up the hill, up the stairs. He said, I had to stop for a while, and hopefully the symptoms go away soon. And number 4 patients I have is headache, dizziness, and I saw her. She said she feels like going to faint. So all these, of course, many of them, all these symptoms, I found out it's only one word, inflammation. Afterwards, still have the inflammation, related inflammation, which reduce inflammation. So what I found, the turmeric, 姜黄, to help reduce inflammation. So actually I told all these 4-5 patients, taking 姜黄 as your food. And you cook with it, you can buy powder, you can buy, supplements, and just add in. And many of them, after 1 week, they feel better. So this is the good news. And also, of course, I use herbs. Yeah, like a 莲花清瘟胶囊, right? When the COVID-19 just started, they all talk about that herb in China. They're using it and help the lighter symptoms patients get better. So I said, okay, so 莲花清瘟胶囊 for light symptoms can get better. Why don't we just use it after COVID-19? Still keep using. And actually, it worked. So you can also to get it, 莲花清瘟胶囊. And also, if you think about 伤寒论, yeah, 麻黄归枝, and you think about these herbs, they started from hundreds of years ago, right? Why these herbs still affect? Because when 张崇景 time, that time also have we saw 瘟疫. We said 瘟疫 actually is like this type of virus. So that's why 张崇景, all these, masters, they actually found out how to treat the patients. I used Chinese herbs. And also, I wanted to emphasize some patients that lost their memory and they feel like, couldn't recognize things. And so we also can use some herbs to help them, right? Like 白芷, 白芍, yeah, and 木栗, yeah, all these herbs can help. So besides the herbs, we also needed to think about how do we treat and use something they can do it. So I teach patients to do ear acupressure. Do you know the ear acupuncture is distal treatment? It's already very successful for many, many fields. But I found out, just ask a patient do by themselves. Because I can't go to Los Angeles or somewhere else to treat them, they should do by themselves. So the liver points, the spleen points, the shaman points, yeah, neurogate, and also the brain points. All these points, you just ask them to do massage. Only need a massage 1 minute and 3 times a day, okay? And also I made 3 points, I told them it's called happy points, like a liver, heart, kidney, and add a shaman. And I said, remember, they're called happy points. You use these 3 plus a shaman. Shaman, I told them what is shaman mean? Means and also means a calm spirit point. So they're very happy to use it every day. And also they show me on the Zoom and they say, is this point right? I told them online, buy an acupuncture ear chart, okay? And you will find all these points. So they are very happy to do it. Yeah, because I don't see them, so I had to let them to do by themselves. Another thing is for the food, from the old experience in China, each flu season, afterwards, during, we have the pear, the steaming the pear, You can steam a pear with the skin together, because skin is the herb too, to help to reduce the short of breath, to cool it down, to help the indeficiency of the lungs. So that is a good one to use it. And also I found out pear also can help to reduce the stress. So that's why it's good herb to and food to use it. And also I like to say exercise, the qigong, tai chi. Just let them to do it. Just teach them very simple movement, and very simple deep breathing. The patient feel much better. So another important point I wanted to talk about, emphasize, is the children. COVID-19 affect our young kids. What is that? When they are born, they already see the parents wear the masks. When they grow a little bit, they wear masks. They all have the problem, don't want to be with people too close, right? Because we need the distance. So when the COVID disappeared, they still feel like, do I need to be close with you? Can I hug you? Or something like that. So the mind, so we talk about the body, mind, spirit. The spirit, the mind, already have that scar. So we had to help these children to actually reduce that problem. Because if we don't do it, they might have an antisocial problem. They don't want to be with the friends, play. They feel, oh, maybe you have something, after COVID-19, they will have all this thought. So the generation COVID time, we had to take care of it. I saw when you talk about this generation will be like 1929 to 1939, the Great Depression time. We'll have that type of feeling. So we had to help our young generation, and acupuncture herbs definitely can help. And ear massage, the happy points, right? And so this is what I wanted to talk today. And also I like to share some 张仲景是伤寒论的 of course, 麻黄汤. In here, I look at 麻黄 we can't use it, but they're using 芝麻黄. Even the 芝麻黄, we can use it, but the store may not sell it. So, but we can use something else. We can use 桂枝、杏仁、甘草, right? We can use other herbs to help to reduce the wheezing, to reduce the cough, and to help to move the water in the body. Okay, so that's the one I would think about. And also I wanted to say another one we can use for the patient, 伤寒论 talk about 桂枝附子汤, right? If the patient after symptoms, after the COVID-19, they still have some symptoms, you can use 桂枝附子汤 to get rid of the phlegm, right? And plus 生姜大枣 is very good. And of course, if you just use 桂枝汤, you don't want a 附子 because patient may be too hot. You just use 桂枝汤. 伤寒论 also have a 桂枝汤. Yeah, 桂枝、芍药、甘草、生姜大枣. Yeah, special I found out if somebody who has headache, you can use 桂枝汤, pretty good. So another one is I will talk about, when a patient having the discomfort, feels pressure, I found out the 薄荷 is a good one to use it. You just get some green tea, longjing green tea, put that with 薄荷, drink it, and very good results. So for the patients, I always say, you don't want to have a big formula. You have some simple one they can use in their life. They can use when they're eating, and like turmeric, 姜黄, all these things, and they can accept it, and it's easy for them. So that's why I want to introduce and also share with you, herbal is food. Food is herbal. My teacher always said, the herbal tastes not good, the food tastes good. That's why you eat it. So actually, it's all same thing, but just how do we make it? How do we put it together as a formula? And of course, exercise, is important. And we can teach children to do some exercise, and qigong, tai chi. Maybe they don't like small, and they can do whatever they want to do. I think it's a time I just share this information. If you need some more information, call me. Thank you.
So once again, I'm Dr. Gigi Shamas. Joanna Zhao is with us today, and thank you for bearing with us. And we're so happy that you're all here. I saw everybody's names as they came up, and it was just a delight to see you all. So Sean's going to go ahead and put that on the screen, and we can recap those herbal formulas, and then we'll have a Q&A. And I did want to let you know, I think you know already because we've used the chat before, but here is the chat. I'm going to type in, here it is. And if you have questions that you'd like Joanna and myself to answer, let's see here. Back to everyone in the meeting. And here it is. So please do type that in for us because we do want to answer those questions as we can. There we go. Very good. So I'm going to just go ahead and very briefly take you through this. And essentially what we've been talking about is the fact that, about a third of COVID sufferers do have a new diagnosis for neurological or psychological conditions within 6 months of their infection. So we know that this is a problem that many, many people are experiencing. Of course, you don't have to have caught COVID for this to be a very high level of anxiety in the last year and a half for you. But we did want to mention that those post-COVID survivors do tend to have those neurological conditions or psychological conditions really affect them and possibly forever. And the next slide, please. And so here we have an example of the Psychiatric Times magazine talking about PTSD, and they've added to the DSM that those who have themselves suffered from COVID-19 might have, a post-COVID stress disorder. It could also be, healthcare workers who witnessed others suffering, those that learned about death of a loved one from COVID. And I thought this was interesting. Those who might have experienced extreme exposure to aversive details. So that could be journalists or first responders. And the next one, please. And so we'll go through these very quickly. You did hear Joanna talk about the case study number 1. That was a post-COVID patient who can't concentrate, has a foggy head. And let's go on to case study number 2. And that's the PTSD patient that you heard about. Very worried, suddenly wakes up at night, no energy for exercise. And number 3, the patient who was post-COVID still having shortness of breath, has to stop frequently even when walking upstairs. And case study 4, the post-COVID patient who has headaches, still dizziness, feels like she will faint. And so for all these patients, Joanna was able to use Jiang Huang, which is the turmeric, daily, that reduces inflammation for all 4. And the formula that we were speaking of, that you heard her talking about, Lian Hua Qingwen Jiao Huang, also known as the pestilence clearing granules. I have heard of that back in school. But remember that these, like other aspects that we're discussing today, it's not intended to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. And so those ingredients, Lian Chao, Jinin Hua, and Zhima Huang. We talked about Zhima Huang, the fried version, instead of the raw version, which is actually much easier to get and probably less liability to use as well. So millennia ago, of course, they used Ma Huang and Gui Zhi, and you heard Joanna speaking of that. And for memory loss, lack of recognition, you can use Bai Zhi, Bai Xiao, Mu Li, as she mentioned. These are the happy points: the kidney, the liver, the heart, and adding in Shen Men on the ear. And steamed pear, you do want to include the skin for the lung yin shu. So the Ma Huang Tang, of course, you can use Zhi Ma Huang, as we mentioned. That's Ma Huang Gui Zhi Xing Ren and Zhi Gan Sao, of course. And Gui Zhi Fu Zhi Sang. I hope I'm not going too fast. Tell me if I am. But, of course, you can use Gui Zhi Tang and remove the futsa if you want to. That might be, again, less liability, but maybe less effective as well. That's Gui Zhi Bai Shao, Shenjiang, Da Cao, Zhi Gan Cao, and Zhi Futsa. You do want to use the fried futsa. Mm-hmm. And she mentioned the epigastric pressure, Bo He Lang Jing. So the mint and the green tea together. And so now Joanna and I will have any questions that you may have asked either in your emails ahead of time or here in the chat. Again, please do feel free to ask us. And I want to start off, if we could, Joanna, I want to make sure that you're there and your camera is on and everything. But I do want to ask you what you've been doing as an acupuncturist. Go ahead and unmute yourself. As an acupuncturist, what you've been doing for your own stress, because I think many of us have really been under a lot of pressure.
Hi, everybody. This is Joanna. Welcome, everybody. And today is Saturday, and I'm happy you're here to share, information of the after COVID-19, especially the PTSD, the patient having problem. So in this video, actually, I didn't talk too much the body acupuncture. So I'm going to tell you, if I see patients who having, some patients, they don't have their self COVID-19, but their parents, their family, their friends, and somebody has it that make them really nervous. So these patients come to see me more and more, and after COVID-19 symptoms, and also during now, and also doesn't have a problem, but they worry and they really feel hurt. So this actually from a Chinese medicine is 7 emotion, the 7 emotion, and also the 6 evils, right? So we had to balance that emotions. So the points actually, talk about the happy points. So these things are for the patients and for ourselves using. The points I'm mostly using for the PTSD and only use 4 points. Of course, you can add something somewhere, pain. One is the Da Zui, which is Do 14. Yeah, Do 14 and the 3 young points crossing is a very good points to have sedate heat. And the second one important is a gallbladder 20, 风池, yeah, to eliminate the wind, yeah, 风池. And that 2 points are very good for balance yin and yang, and adjust the qi and the blood, and also opens orifice, opens mind, opens brain orifice. Normally, in a long time ago in China, we do use for patient who has PTSD problem and also mental problem, because this COVID-19 also caused some patient has mental illness. So these 2 points are very good. I ask the patient, lie on the side. I can do 14 and can do gallbladder 20. Then add another 2 points. One is heart, 7, Shenmen. Another one is Neiguan. Okay, because Shenmen Neiguan can calm spirit, right? Everybody know you're acupuncturist, you know that. And also can clear heat and calm spirit. So why? Because the Neiguan, the P6 is J channel. And also the lower points, the connecting points, connect many channels, connect Shaoyin, Sanjiao, and also Yin Wei, the connecting points, right? So that's why it's very good points for using. I told the people before when I was in the school, once we had to do the dissertation, I got really, too excited. And I just palpate and massage at that point, I don't have a needle at that time. So it's calming yourself down. So this is a good point you can use anytime, right? and clear the heart spirit, calm spirit. So that's what I was thinking. I want to add in today because I share what I actually treating patients. The 大椎风池神门内观, which is do 14, goblet 20, and the heart 7 and pericarditis 6. Okay. And another one I wanted to add is the treatment for the patients, the herbal. There's a herbal, 酸枣仁, cooked 酸枣仁, roasted 酸枣仁, okay? Jujube seed, right? Jujube seed. The 酸枣仁 can calm spirit, yeah, and also can help the sleeping problem, and also tonify the liver, yeah. So yeah. I added that point. I added that herbal for the patients actually have pretty good results. Yeah, they can just have a 酸枣仁 like a regular tea, Okay, so of course something else, 酸枣仁、茯苓、知母、川穹、甘草. You can use that channel, the herbal formula too. Thank you. And if you have any questions, I'm happy to share with you.
Very nice. Thank you so much. And I wanted to add as a personal note that I love Swanzaren, the formula, and I sometimes will even add Hehuanhua, what some people call the collecting happiness flower, to it. My patients have always loved it. Sometimes I call it the happy flower for them. And the idea is that you gather that happiness. It kind of adds to the Swanzaren. And Joanna, we did get a question earlier that had to do with what are some of the very specific residual effects of COVID-19? And to speak to that, of course, we talked a little bit about those, the 34% of folks that can then be diagnosed after COVID-19 with, a psychological concern that probably they either had that was low level or maybe didn't have it at all. I know of those 17% will be diagnosed with anxiety disorder. And I'm curious also whether you would consider, do you consider kind of a trajectory of treatment? So you start in one place and kind of have them come over the course of a certain number of treatments, and how many treatments would you recommend in that case?
Okay, and I would say from now on, you don't even know if this side effect is a residual or not. If it's too short a time to me to say it's residual, but I hope it's not residual.
Yeah.
Yeah. But if we, as a practitioner, we had to prepare for if it's possible residual. So we need a plan for the patients. I do is when I see patients, they come at the next time. Oh, just like you always ask, what do you feel? Are you feeling better or what? Just to write down all these records and to find out if they are getting better or they're getting worse, right? So always I would do it because we talk about the 精气神, body, mind, spirit, and Gigi just talked about. So we always treat the spirit, the 精气, the 精 and the shen, and the with the qi, right? So that's why I was thinking each time they come, doesn't matter the symptoms getting worse or not, you have to do calm spirit treatments and then other treatments too. So I can't say this one can be residual or not in so far, but I hope it's not. Okay.
Very good. And can we use cranberry to replace Swanzauren is one of our questions.
Yes, no. Well, if you don't have a Swanzauren, you want to use cranberry, maybe, yeah, I haven't done this research yet. Yeah.
Maybe some, I was going to say like jujube or a different type of date could be helpful. So sometimes, if you have certain things around the house, not others, sometimes you can use other things. But of course, the Swanzauren is going to be probably the very, the very top level.
Well, you know what? If you want to, maybe they're also, sour taste and for the liver, maybe that's okay. Definitely. Yeah.
Well, I was talking earlier about, when you make a tea and sometimes you tell patients, well, listen, if you happen to have this growing around your home, you can go grab it. I have mint that grows right by my driveway, so it's kind of like, well, it's maybe not as effective as if I were to buy the boha and get it, granulated and so on, but to have a little bit of mint from your yard, a little bit of lavender nearby, sometimes it makes it easier just to tell patients that they can do that. And there was one other thing that I was going to bring up, which is that for those of us that became parents in this time period, which we did, boy, that was very difficult. And there's a certain amount of stress that comes along with being first-time parents in the first place. And then we had the COVID anxiety, the COVID isolation, and so on. Are there any certain points or herbs that you might recommend? And then I had a few thoughts myself, having kind of gone through it. I have a few things that I'd like to add, but I want to hear what you think, Joanne.
Question. Actually, for the parents, they had to stay home, and because the kids are home, online teaching, it is very difficult, very difficult. I have my daughter too, and she said that, I want to do something, and then kids say, mama, this, and, and then it is almost every family, you have kids online study, you have a problem. So what I told my relatives or my daughter and the other people, you should not be first person stressful. You stressful, you harm yourself. It's no use. And you stressful, kids can feel it. And you can say to the kids, hey, you don't play, you have to watch the video, you have to do this, that. Give them more pressure, and they actually will dislike to do the online study. So had to be very relaxed situation. Also, the sancha, the herbal, right? Sancha is very good for, invigorate and help and open, and also good for many channels. So and for digestion, and also you can use the sancha, make a tea, put a little bit of honey, and give your kids to drink, and they love it. Yeah, just a few pieces of sancha, because sancha is sour. Why? It's come to the liver channel, have the liver, and also have the heart. It's very good, and have the stomach too. Yeah. So I suggest them to do that. And the patient come to me, and they have kids at home. Yeah, that's what I suggest. And also, relaxation, relax is important. I have my daughter, the 5 years old daughter, my granddaughter, right? When they send a picture to me doing meditation, I was so scared. Like a little Buddha doing meditation, sit on the little pillow. I said, wow, that's wonderful. You should, let every classmates do that, because the teacher actually teaches them to do small little meditation. They love it. Okay.
That's fantastic. I don't know if my 1-year-old will do that, but I can try. I can try. One thing that we do with her, and this is very helpful for as parents as well, is that we dance, because there's exercise. I try to teach her a little bit, sometimes Qigong, Tai Chi, sometimes she just wants to do what she sees people on television, on the YouTube videos doing. But we dance with her, because you have to move the chi, and you can't feel so stuck. And that's one thing that I was going to mention, that I'm sure that we've all been feeling, whether we're helping patients who feel a little bit stuck this last year, or whether we ourselves have felt stuck inside, isolated, and so on. Of course, you all know that one of the best things that we can do at this moment in time is to get vaccinated. It does take quite a lot of anxiety off my shoulders to be fully vaccinated, and to have people at the school that are now vaccinated. I can hug Joanna next time I see her. So that will be
That'd be great.
So that's an idea that seems almost very bizarre now, but we have been living in a bizarre time. And so being able to hug your friends, shake hands, everything, it's different. But I'm kind of teaching my 1-year-old, dance, move, get yourself kind of not feeling so stuck. So if there are things you can do to not feel kind of tightly wound like that, it's good for the liver channel as well. And then what would you say in terms of, you mentioned some of the points at the Do channel. I remember there was one of our professors at Five Branches who recently sent me some information. She said, just like you said, do 14, and she said, do 15. And then I wanted to add to that maybe a little bit of do 20 and do 24, because those I think can be so helpful for the anxiety.
Yeah, you're right. Do channel, actually the young channel, Do channel and, CV channel are all good for calm spirit. If you use, certain points like a Do 20, also, young channel. So calm spirit, you can add a Do 20, but I just do the one and just, 4 points easy. Yeah, sometimes I do.
Very good.
I do 20, I do 四神聪 often too.
Oh, yes, very good. And what about, I was going to say, there's a kind of combination that I've noticed for, for folks that are kind of treating patients, but also struggling with maybe some of their own anxiety and depression. And I find that treating myself right before I treat patients can be very, very effective. So if you're if you're going to see somebody at 9 a.m., maybe 8:45, you do a little bit of, for yourself, maybe large intestine 4, heart 8. I found that those are very helpful for kind of getting you in the mode of treating others. That's kind of a personal take that I have, but the combo, so you're sort of treating that heart, fire, and heat, but you're also kind of calming the large intestine channel. You can do LI11 along with, and I found that those are just a few points that you can easily reach on yourself, but that you can do right before you have patients. So any that you recommend in that vein?
Very good. Large intestine 4, of course, when you only have 15 minutes, you can't take off your shoes and so
that's right.
Do the 4 gates, right? And the 3 and the large intestine 4. It's good to add a heart 8. That's perfect. Yeah.
I do love heart 8. I find it to be very good also for palpitations. If you happen to be so anxious that while you're treating patients, you kind of notice yourself shaky, a little bit of palpitations, you could definitely do that. So we wanted to mention all of these things. We're coming to the end of our time. We will send out a little recap so that you can kind of take a look at the formulas for yourself as well. But we did want to mention a couple things too, that you are always welcome to go to fivebranches.edu, and you'll learn more about the Bridge program, the DAOM, and some of our other webinars. So we wanted to say thank you so much, and really appreciate it. We want you to get on to your Saturday and enjoy yourself. So thanks for being here with us. And Joanna, do you have anything to add at the very end here? I want to hand it to you.
I just want to say thank you, and happy Saturday, happy Sunday, happy even after COVID-19, and just enjoy your life. And even if you have any problems, symptoms, always can call us, and we help each other.
Thank you so much, everyone. We'll be in touch, and have a great day. Thank you. Bye now.